Hello everyone and welcome back to my channel. For some of you that don't know, I've asked the scoliosis community that joined my curved spine private group, what is it that they would like to know about Schroth therapy? With the aim of educating and bringing to your awareness the possibility of living pain-free with scoliosis, as promised, I have interviewed one of the smartest people I've ever met in this field, who happened to be my therapist as well. Her name is Eszter. Please note that the answers are based on short questions with limited description about one's condition, and it is really difficult to be accurate without being assessed in person by a certified therapist. Disclaimer: the information in this video is not intended nor implied to be a substitute for professional medical advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained in this clip is for general information purposes only and does not replace a consultation with your own doctor or health professional.
So Eszter, could you please tell us what is it Schroth therapy?
Yes, the Schroth therapy is a physiotherapeutic method, and it's morely an active therapy for treating the spine, the scoliosis, and some other spine deformities. For example, the Scheuermann disease. It's a very complex and a very nice method. It's very complex because it's treating not only in one dimension, and it's treating not only the side bending of the scoliosis, for example, but it's also treating the rotation of the trunk, and it's also treating all the curves and not only the main curve of the scoliotic spine. It was developed the last century in Germany from Katharina Schroth, and later on it was developed further from Christina Leonard Schroth. She was the daughter of Katharina Schroth. And now in Germany there's the Schroth Clinic, where many German patients and some patients from Europe can be treated, and they are also making some courses for physiotherapists, so every physiotherapist from all over the world can learn the Schroth method and treat the patients with it. It's a quite complex and complicated method because it's focusing on all the deformities and all the asymmetries of the spine and the trunk. The main point is that we try to treat the spine and the trunk in a very corrected and a maximally corrected position. And this is the difference between other physiotherapeutic methods and some gymnastics for the spine. So we try to treat and correct every single asymmetry of the trunk. The position of the head, the shoulders, the chest, the pelvis, the hips, the knees. So it's a very overall treatment of the whole body.
Good, that sounds yeah, perfect. How effective would you say that is this method compared with all other methods that are out there for this?
So this is a hard question because to say a method is really effective, we should make some control groups. But I'm working with the Schroth therapy for 15 years, and I really see that this can be done very effectively. And also in the X-ray pictures and in the aesthetical outcome of the patients, it can be very effective, and we can have some very nice results. But nowadays here in Hungary, we work more and more with the Schroth therapy, so I don't really see too many patients who work with some other methods because it's overcoming the whole scoliotic patient group, the Schroth method.
Would you say that there's anywhere that people can see some after and before photos of people that have practiced Schroth?
Maybe at the website of the German Schroth Clinic. And because I think there are some closed groups where they can show these pictures, and maybe in some physiotherapy papers. and in some articles, but I don't know whether there's a big platform to see before and after. Maybe on websites of some praxis around Europe, maybe they show it, but I don't think that there's a platform where they have many pictures about it.
Mm-hmm. How effective? Sorry, how often do you have to do it per week or per day in order to make a difference?
Mm-hmm. So there are some general principles from the scoliosis, how it can develop during the years. So normally we say that at the age of 19 or 18, the growing stops. So then maybe you cannot expect more increase of the scoliotic spine, or the scoliotic deformity is then stopped and fixed, because no more growth of the body and the spine is expected. In these years, so in the teenager and years and in the childhood, me and my colleagues, we see that daily exercising is needed.
Mm-hmm.
Because if you can imagine that during the day the patient is vertically about 16 hours in a day, then the gravity and or body weight is on our spine, and then daily exercising is really needed to stop the curvation or stop the increasing of the scoliosis. But after the end of this growing, or after the end of the ossification of the bones, in the adulthood, daily exercising is not needed anymore, because we don't expect increasing of the scoliotic curves. It depends on what the aim is of the patient. So if an adult wants to get a more aesthetical outcome of the trunk, then of course more exercise are needed. If someone has pain, then maybe some parts of the exercise or some movements are needed daily, but maybe not the whole program. So with adults, weekly 2 or 3 exercising programs are enough, or should be enough.
Good. So how long do you think it takes for them to learn it? Like from the moment they meet a physiotherapist like you, how long does it take for them to understand and practice that on their own?
Mm-hmm. So normally we start with a physical examination of the spine and of the spinal movements, and we do an anamnesis. So that's quite normal with physiotherapy, like when you go to the doctor. And we check all the movements, we check all the deformities, we make some specific testing, we make some measurements of the spinal movements and of the movements of the whole trunk and body. And after this examination, we say that in 10 sessions, you can learn some really nice basic exercises, and you can learn to correct basically your pelvis, your trunk, your shoulder position, your head position, and you get some complex exercises to correct your asymmetries and your spine. And then you can start to go on in your home and start to practice it. So for the basics, I think 10 sessions are enough to learn it and to get some information about your spine, to get some knowledge about this problem, and try to do it at home alone.
Right. So I've received quite a few of messages from people from their third world and which don't have yet access to a physiotherapist. Is there any way that someone that doesn't have access to Schroth yet to do something at home to start to get accustomed to this method?
Yes, so if a personal session is not available because of the distance or because of this new situation now in our world, then we can offer online therapy, and we can also make some kind of physical examination online, and we can start to build up the exercises. So normally we can give some hints how they can use any equipment at home or some furnitures, or if somebody has only a rubber band or an elastic band, it's really useful and they can start to do the Schroth exercise with it. There are many patients who are exercising more years and they don't have specific equipment at home. The point is with the Schroth method that we do everything in an upward elongated position.
Mm-hmm.
So if a patient is doing some exercises in an elongated position and in a quite corrected position, it can be good for the spine. But we do also some specific muscle activities and some specific positions which can be even more helpful. But without too many equipments and without a gym at home, they can do their exercises quite good and nice.
Perfect. So all they need is a laptop. Is that correct? And internet connection.
Yes.
Okay.
Yes. They need a laptop, and then during the video I will see how they can use some equipments like a chair or like a bookshelf, and they can do some muscle activity with some kind of really simple furniture, and maybe only an elastic band is needed because they can use it in many ways and we can activate with it many specific muscles.
So I've had some parents asking me lately. They've done Schroth, everything is good, it's successful. The kids are enjoying, they're out of pain, but it's kind of become like a chore and kids get boring. Do you have any sort of suggestion how to do it to make it more entertaining for a child?
Yes, this is a hard question because the exercises are quite strict, and we are following the same procedure every time. So we correct the pelvis, we elongate the spine, we do some breathing exercises, and then during the breathing we do the active muscle activity.
Mm-hmm.
And sometimes children and teenagers says, okay, it's really hard to follow, and sometimes it can be a bit boring for them, especially because they have to do it every day. So maybe you can try to do in many starting positions, and with some, you can use some bowls, and you can try to bring some other exercises too, but the core of the therapy should be these quite complex and corrected exercises. So if then somebody has a physiotherapist who, if they can meet, then they can do some nice and maybe otherwise complicated exercises with more equipment in the praxis. But for home, I think it should be very important that they do it daily and they do the most correcting exercises. And then when they play a little bit in between or at the end, or they do some maybe funny but not so much correcting exercises, it can be more cheerful. But the core and the main point should be this type of correcting program.
Good. Do you know what brace would help a person with I don't know how to pronounce this, kyphosis
Channel?
and scoliosis?
The
Yes,
kyphosis, yes. Oh, kyphosis, yes. In Europe, in the last 2 decades, we use the Cheneau corset.
Mm-hmm.
So the Cheneau corset is the most correcting corset type. It's made of plastic and it's 5 millimeters thick. So it's made of hard plastic. And it's built individually, so they have to go to a technician who is making a sample of the body. Nowadays, the sample is made with a computer, but maybe there are some praxis where they make it out of plaster, and then they made it out of plastic.
Mm-hmm.
There are some holes in it, and there are some compression points. And unfortunately, it is quite uncomfortable because it's pressing some parts of the chest and the shoulders, but it's giving a correctional compression. So over 20 degrees of the scoliotic main curve, physiotherapy is not enough anymore because we cannot tell the patient how the outcome will be. So in many cases, this corset is needed. So the most correctional corset is the Schroth corset. In the last few decades, there were some other corsets like, for example, spine core or the Boston corset, but unfortunately, they don't give 100% correction. And in the case of a scoliosis, with so many asymmetries and with such a complex deformity picture, this type of hard and 100% correction is needed.
Right.
And for the kyphosis, sometimes if kyphosis and scoliosis are together, also the Schroth corset is needed. But if there's, for example, only a thoracal kyphosis, so in the upper spine, then another type of corset named Schroth corset is enough and it's good correcting.
Okay. So now we're going to get into more personal questions. I've had some people sending me a little bit more related to their problem. And one of the questions was, can Schroth help minimize the large rib hump decades post-fusion, which has significantly increased over time? What are your thoughts on that?
Yes, I think the first point would be that we should stop the increase of this thoracal or rib hump or rib prominence. So the first step would be that we try to bring the spine and the spinal muscles into that position that we can stop the increase. Unfortunately, this is possible that after an operation, after a fusion, the deformity goes on. So the first step would be, if there's pain, then we start to decrease the pain and we start to decrease the progression of this curve. It depends on many factors. So unfortunately, without having a look at these patients and without making an anamnesis, it is really hard to answer. But if we can find the proper position for this patient, and if this patient can elongate a little bit and activate the specific muscles, there could be a chance for it. But the main point is, and this is really important, that the main point and the main aim should be that we stop the progression.
Right. Okay. Thank you. Another one is like, how effective is the Schroth method for someone who is almost 74 years old with an S curve that is about 60 degrees upper and lower? Can it reduce pain?
Yes, this is also a hard question, because 60 degrees of curve is influencing the surrounding tissues, the muscles, the ligaments, the nerves, and it depends on how much the patient can elongate actively and how the patient can hold this elongated position. So, of course, therapy is needed if there's pain, and if the patient has the feeling that the scoliosis is increasing during the years. But maybe we have to start with other methods. So if there's a big pain situation, then maybe not the Schroth method would be the first. So we would try some other maybe manual therapy methods like Mulligan method or Maitland method if we can meet. If we can meet only online during in a computer, then maybe we start to build up some exercises for reducing pain, and when we can handle the pain, then we start to do some correctional exercises according Schroth. So there's a big possibility, but maybe not the Schroth method will be the first step.
Right, okay. Would you say that Schroth can help congenital scoliosis and hemivertebrae?
Normally, we use Schroth for those types of scoliosis which are not congenital, which are growing during the growth and starts over 10 years in a child. But in congenital scoliosis and hemivertebrae, we do the same exercises. So active elongation and fixing the elongated position. But with congenital scoliosis, maybe the outcome on an X-ray picture won't be so visible like in another type of the scoliosis. But if no operation is needed, then with the conservative therapy, so with the Schroth therapy and breathing therapy, we can also influence congenital scoliosis too, but maybe the effect won't be like with other types of scoliosis.
Okay, thank you. And now is like, would you recommend Schroth therapy to a 14-year-old boy who is in Risser 3, post-peak height velocity, and has grown an inch without progression of the curve? No discomfort or pain from the scoliosis. However, his scoliosis curve is an S with a 24-degree.
Yes, so with the age of 14 and Risser signs 3, it means that he's still growing. And maybe we can expect that he will grow until the age of 17 or 18. So the Risser sign shows you on your pelvis how the growing is going on. So it's a sign what we use for checking whether the patient is still growing. But Risser 3 is the middle, so he will still go on with growing. And 24 degrees means that this is a moderate but not slight scoliosis. So if he would come to me as a patient, I would recommend intensive physiotherapy according Schroth, and I would recommend also a corset, a Chanel corset. And maybe there was a growing period where the spine, where the muscles could handle the spine, but unfortunately we don't know what will happen in the following 3 or 4 years, so he would need therapy, because a curve with 24 degrees can be visible and can be with some rotation of the trunk. It's not a severe curve, 24 degrees, but it should be treated, because then the outcome when he's getting an adult will be much better. So now it's the time with 14 that he has the chance to correct it, and he has also the chance, if he makes the proper and the good correctional exercises, that he can really minimize the curve.
So would you say that he would wear the brace for perhaps 3 years until he stops growing?
Yes, I think so. And when the curve goes under 20 degrees, then maybe he can get some free hours from the brace, because we say that between 16 and 23 hours of wearing is beneficial. And if the curve goes under 20 degrees, then maybe he just have to wear it during the night and a few hours at home, and maybe not anymore in the school.
Gotcha. Thank you. Would Schroth Method be helpful for a 66-year-old woman with hypermobile EDS?
Yes, so there are some soft tissue and muscle conditions which are not in the physiological frame. So someone is hypermobile, someone is hypomobile, which means that someone is stiff. So hypermobility means that the tissues are more elastic than physiologically, we say, and maybe then the muscles have to make more work than in a physiological relation. So I think in these special situations of special mobility of the joints and the spine, maybe more concentration on the muscle activity and on the correction is needed. But hypermobility is just a situation, so it's not a disease, it's not an illness. Maybe it can be a factor that will be the cause of some problems. So maybe some parts of the spine are more underloading than physiologically normally. So maybe she will need some more care and some more concentration, but they should give a try, because correcting the spine and doing some exercises in a correcting position could be beneficial for her.
Thank you. Another question from a father who's asking you actually, can a 13-year-old child with Sotos syndrome be treated with Schroth therapy? He has a double curve around 45 degrees with some rotation.
Mm-hmm. So with some genetical diseases, the point is always whether the child can communicate, or whether the child can concentrate and focus at least 30 minutes on these specific exercises. So we can bring the spine and the trunk in specific starting position where we can do some muscle activation if the patient understands what we would like to do. So there are some genetical diseases with some specific deformities. It is a group not like the other type of scoliosis group, so maybe the effect won't be other, but I think in this situation and in every scoliotic patient, the first point is to stop the progression, and maybe with some easier exercises or with some parts of the specific exercises we can help the patient. But the most effective the therapy will be when the connection is good between the patient, the therapist and the parents, and the communication is good. So it depends on how the patient can do these active correctional exercises.
That makes sense, yeah. Would you say that a curve around 30 to 32 degrees can cause sciatica pain?
Yes, so there are some studies which shows that the degree of the scoliosis and the pain, whether it's a muscle pain or a joint pain or nerve pain like sciatica, is not in relation with the curve, so how big the curve is. But if the curve is as big that the bony foramens or the bony hole are getting smaller where the nerve comes out, then it can have an effect of the nerve. Here with some elongation and maybe with some manual therapeutic procedures, we can help to give the nerve more space, and maybe then the sciatica pain will be less. But there's not a really relation between the curve and the sciatic pain. But of course, the point would be that we give this nerve more space and the nerve should move. And maybe if the scoliosis is in a more elongated position, we can create for the nerve more space.
I must say that I've had the same issues with sciatica, and after I've done the exercise you told me, like in a fetus position, and to straighten one leg and just to bring my head, that really helped me. So
yes.
no sciatica
Yes,
pain for me.
Yes, this was an exercise for the nerve movement. And of course, when a patient comes to us with a scoliosis, then We don't only treat with the Schroth method, we use some other exercises and some other interventions from other methods. And then we decide on that day for that patient, for his or her pain, which exercise would be the best. But if there's a scoliosis, then of course, after a few sessions, when the pain is getting better, then we try to work with the scoliosis and do the correctional exercises.
That's perfect. How would you say you could minimize pain when you bend? A lot of people seem to have pain when they go and pick up something on the floor.
Yes. So it depends on where the pain is, how big the pain is, whether it's just a local pain or it's radiating into the legs or into the buttock or in front into the stomach. So if it's a quite acute pain, then we tell the patient that maybe they shouldn't do bending a few weeks and try to maybe lift something from the floor with a squatting movement. But this period should be quite short, because if someone is understanding this, that okay, I cannot bend, and it's forbidden for forever, then they are causing some other problems, and maybe there will be some other pain situations because of this. So it depends on what causes the pain. So if someone had an injury with bending and lifting something, then the muscle will protect this part of the trunk and the spine, and maybe bending is not even possible. But there are many cases where a few weeks bending is painful and uncomfortable, but the body has a very nice self-healing how should I say? So the body can heal themselves, and maybe in a few weeks it is going better. But that's normal, that if bending is painful, then people are afraid that I will damage some tissues, so I cannot bend anymore. But this can lead to even bigger and more problems. So I think if somebody has a problem like this for more than 6 weeks, then should consultate with a physiotherapist, and with some questions and with some movement tests, the physiotherapist can tell what causes the pain and give some exercises, and maybe teach the patient not to be afraid of moving, and learns how they can handle this problem, and then it will go away.
Thank you for that. And one of our last question is, any tips in choosing a chair for better posture? A lot of us working, sitting and stuff.
Yes. This is a very nice question, because everybody is sitting all day with working. And the point is that there's no chair which is the best. There's no sitting position which is the best. Changing the position is the best. So now we advise our patients that 20 minutes of sitting should be one period. And after this 20 minutes, the patient should stand up for a few seconds or a few minutes. Maybe there are some patients who can work a little bit in standing, so one period in sitting, one in standing, sitting on a physio ball, sitting on an office chair, sitting in crisscross sitting with your laptop. But the point is to change the position, and there's no chair, there's no equipment, there's no sitting device which is the best. So the best is the changing. And that's really important, because the older days we teach our patients which is the very best correcting sitting position. But it's not working, because you cannot concentrate all the time on your posture. Yeah. And there are many studies which show that the changing is the point. And this is very important, and maybe the patients should try out some different positions, for example, sitting straight, sitting slouched, sitting on the edge of the chair, standing up, sitting on a ball, moving a little bit. This is the point. So there's no perfect chair for sitting.
Thank you very much, Eszter. That was awesome.
Thank you too.
Okay, well, I think that's it. I think we've done faster than I expected. I thought we were not gonna. That was really good, like on point. I love it. Thank you so much.
Okay, I hope it was helpful, because I know that these questions are coming. So I have this and that disease, and what do you see, what will happen? So in this situation, we always can say some overall general things. But when we meet a patient, for example, with this Sotos syndrome,
Yes.
I didn't ever hear about it, so I had to check it, what this is. And I also read that this can give some mentally limits too. So it depends on how the patient is reacting. So I had some patients with some mental deficits, and then we made the exercises much more easy and not so complicated, and it could work. So it always depends on how the patient is, and then we just can say some general things like this.
Yeah, no, I mean, I've tried to tell people the same, like, look, you need to be there with the therapist in order to get the best results out of the therapy. However, a lot of people don't know about this, and I thought people should get educated and see, like, I spread the word, like how much benefit this has helped me. Like, it's crazy. I was really skeptical when I came to do this. And then in the first 5 hours after I got out of the clinic, I just felt so light, and it was amazing. And I've read like 20,000 people in a scoliosis group, and everyone is crying in pain. And I thought, it's something out there that you can do to improve your life, but no one knows anything about it, or they know.
Yes. Just a little.
Yes. So that's why I said I'm gonna call Eszter.
Yes, and it's very nice that you make this group, because I think I can tell many things, but if you had the experience with your own body, this is the main information, because
Exactly.
because you know how they feel, you have the same or nearly the same or some pain like them, and this is the most valuable information, not something what I can say out of books, but because when you felt it, that's your opinion. It's very nice. So I think it will be helpful if
Well, it
if
should be, yeah.
yes.